about to go down. I said, y'all, it's about to go down.
What's going on? What's going on, Facebook? What's going on, YouTube? Welcome to another edition of Kidney Disease Education Moment. I am your host, Steve Belcher. So tonight, I'm just going to do a brief education on this hand sanitizer. And also, I'm going to talk about give you 3 tips on eliminating or minimizing infection if you're a dialysis patient. But first, I just have to tell you, I may look happy, but I would be lying if I didn't tell you that I am dealing with anxiety and a little mental health behind this whole virus situation. And only thing I can do is get outside of myself and continue to do what I'm doing and turn it over to God. I know I'm not in control of anything. I am powerless over people, places, and things. And I just try to remind myself each day when I wake up with this anxiety, not knowing what the future holds, but taking it one day, literally 5 minutes at a time. And also, saying the serenity prayer, God grant me the serenity to accept the things that I cannot change, the courage to change the things that I can, and the wisdom to know the difference. I just try to go by this each day as we are all in the same boat with this virus. Some people may be at risk more than the others, but the fact remains the same. We are all at risk. So what I try to do is do these different education sessions to take myself and my mind away from what's actually going on. Because at some point, this has got to end, and we have got to move on to a new normal, which will not be like it once was. So if you're on dialysis, you got kidney disease, you still have to deal with that in retrospect with the coronavirus. So there are tons of information and education that you need to know as a kidney warrior, whether it's pre-dialysis, during dialysis, or post-transplant. If your life centers around kidney disease, there's always going to be a need for education to deal with this disease. And that's what we're going to continue to do in spite of what's going on. And we just need you to continue to come on, support, interact, tell us how you feel, and share your experiences, anxiety. In fact, if anyone wants to come on any of our shows, we would do a special show just if you want to just sound off, get your emotions out, or just say what you feel about what's going on with this whole situation. We will let you have this platform to do it. All we need you to do is reach out to us, and we'll provide that platform to you. I'd like to say hello to Leslie. I'm doing as best as expected, Leslie. I hope you're doing well. Angela, thank you for tuning in from our YouTube page. Anyone else who's watching, if we have any warriors watching globally, thank you for tuning in, because we know you could be watching anything else. I mean, there's a I don't want to say a competition, but everybody's doing online stuff now, talking about this, talking about that. But we're going to talk about the information that deals with people with kidney disease. And if you want to learn if your family members dealing with kidney disease, any friends, then we're here to provide that information. So let's get into this. Let's talk about this hand sanitizer, right? There seems to be a need for this. It's sold out. No one can find it. You may can find it now. But, this been around for a long time. Working in dialysis, I mean, over 10, 15 years, we've been having hand sanitizers. I mean, boxes of it. I mean, we couldn't even get people to use it. And now you can't find it. I mean, that is absolutely crazy. Now, look, hand gels, hand sanitizers, they're popular now. You can't even find any. But check this out. If you don't have any, or if you didn't get your hands on any, ask yourself this question. How do they compare with soap and water, right? And when should they be used, meaning the hand sanitizers? Now, let's break it down and what's in this, all right? You got alcohol. That's the main ingredient, right? That's the main ingredient. And the solution should be 70%, all right, or more. It could be, normally they contain 60 to 95% alcohol, but hand sanitizers contain alcohol, which is the main ingredient, a thickening agent, plus an anti-drying agent. So most hand gels contain isopropyl alcohol, right? Or ethanol, plus a thickening agent and a moisturizer such as a glycerin. While hand washing rinses dirt and bacteria from the hands, a hand gel attaches. Now, this is important that you listen. A hand gel attaches to the microorganisms on the hand and then either kills or inactivates the organism. Here are some examples. So bacteria, including antibiotic resistant bacteria like MRSA, MRSA, or VRE, are killed by the alcohol in the gel. Fungi are also killed. Now, when we talk about the viruses, including those causing the common cold, the flu, herpes, and HIV, become inactivated by the alcohol. You see the difference? The viruses become inactivated. But not all disease-producing organisms are susceptible to the alcohol. Spore-forming gram-positive organisms such as C. diff or Clostridium difficile, which causes diarrhea, may not be killed by hand gel usage. So again, the hand gel is going to kill some viruses and bacteria, but not all disease-producing organisms are susceptible to the alcohol, such as I just said, the spore-forming gram-positive organisms, such as C. diff. You got to wash your hands. Now, make sure if you do get a bottle of hand sanitizer, check the percentage. This one is 62%. All right. Now, the Center for Disease Control and Prevention recommends that hand gels contain 60 to 95% alcohol. When buying hand gel for your home or car, check the label to verify the concentration. All right. Make sure it meets minimum standards. Now, when applying the gel, place the product in the palm of your hand, right? In the palm of your hands, rub your hands together, and then rub the product all over your hand and fingers until they dry in the crevices, all over them, not just like that, right? So let me give you an example. So I put it in the palm of my hand, right? It's in the palm. Then you wipe it, and then you go all over your hands in the crease, in the crevices. Got to make sure you get all over. And that's pretty much it. Now, studies have shown that alcohol gels containing 70% alcohol kills 99.9% of the bacteria on hands 30 seconds after applying the gel and 99.99% after 1 minute. When should hand gel not be used? All right, we talk about when using it. When should it not be used? While using a hand gel can disinfect the hands, it cannot clean the hands of organic material. I repeat, while using a hand gel can disinfect the hands, it cannot clean the hands of organic material. Soap and water, again, soap and water are needed when hands are soiled. Soap to help break down the natural skin oils that germs can stick to, and water to rinse the germs from the hand. All right. So if you get dirt, some stuff on your hands, you know, maybe you changing or feces or whatever, I mean, you need soap and water. So I say that to say, if you don't have hand sanitizer, get yourself some soap and water, right? You could put some soap in a squirt bottle, right? Soap and water. You can get 2 separate bottles, fill one up with soap and water, and fill the other one up with water, right? Squirt your hands. That's if you're away from home. If you're at home, you know, the sink. But if you're away from home and you don't have this, make yourself a concoction of soap and water. And after you touch something, squirt your hands with the soap and water with the spray bottle. Rub your hands together, right? For 20 seconds or more. I would say a minute. And then once you do that, right, you get the other bottle, squirt it off, squirt your hands down or whatever with the water, and then dry your hands. That's if you out and if you don't have a hand sanitizer. Or you may have some other way. You may make your own hand sanitizer. I'm just trying to point out some ways that can help you if you find yourself without a hand sanitizer. When hands are not visibly dirty, consider alcohol hand sanitizers as an acceptable alternative to soap and water for hand hygiene. Or you can use just straight alcohol. Just get some straight alcohol, put it in a squirt bottle, squirt your hand, because alcohol is the main ingredient that kills the viruses. So you can do that. We used to do that working when we were exposed to bed bugs and spraying our clothes down before we left the unit. Remember, the single most important thing we can do to keep from getting sick and spreading illness to others is to clean our hands. This has been around. The material I'm reading from goes back to 2008. So it's always been a push for hand washing, infection control, masking up, PPE, protecting patients, protecting healthcare providers. But a lot of people have been very laxed. If soap and water aren't available, use alcohol-based hand gel. That's only if soap and water is not available. All right. So now I'm going to talk about 3 tips on which focuses on hemodialysis patients that highlights 3 key ways to minimize or eliminate infections. All right. Number 1, and you can, if you have a family member on dialysis, like a mom, dad, uncle that you're caring for, you can definitely apply to this as well. Absolutely. So just wash your hands. Wow. Leslie said she can't even find the alcohol to make it. How you doing, Miss Betty? Wow. Yep, just wash your hands, like Shamika said. Wash your hands. But look, here are 3 key ways to help minimize or eliminate infections if you're on hemodialysis. Stay well dialyzed. What I mean by that, we all know as kidney fails, the urea, BUN, creatinine, and other ways increase in the blood, causing uremia, which is a host of symptoms. One of the many unwanted results of uremia is its negative effect on the body's immune system. So as your body builds up with these toxins, it lowers the immune system, making it more difficult for your body to fight off organisms that can cause an infection. So even if you have a catheter or a graft, you want to make sure that you're keeping that clean. And I'm going to talk about that. But first, you want to stay well dialyzed. And how can you help do this? Always, I mean, always, even in spite of what's going on, always dialyze your scheduled length of time. Always. Also, you want to keep track of your KT over V reading. And that is a low level indicates that your dialysis treatment isn't cleaning your blood adequately. So your KT over V should normally be greater than 1.2. Yep, finish your whole treatment. But your KT over V should be greater than 1.2. That's the minimum. All right. But if you want to feel better, it should be greater than 1.2 because, again, a low level indicates your dialysis treatment isn't cleaning your blood adequately. If your KT over V level is low, you need to talk with your team to find ways to improve it. Do you need to increase your time, increase your blood flow rate? Do you got a catheter versus a fistula or a graft? What size dialyzer are you on? I mean, there's so many factors in that you got to think about to see what's going on while you're getting low KT over Vs. The second one, wash your hands again and access arm when you enter the unit. So I'm not sure if they're allowing that now. If you go to a unit, do they still have people going to the sink to wash their access? I know when I was with DaVita, we had a designated sink for warriors to go and wash their access on before they go to the seat. So definitely wash your access before allowing anyone to clean your alcohol and the betadine, and before they put that needle in, make sure your arm is super clean. That's very important because let me tell you, if you get an infection, not by the coronavirus, but what if you get, say, MRSA or C. diff or VRE or like a staph infection that lands you in a hospital, and as a result of that, you may catch the coronavirus. So, you know, you got to be prepared on all fronts. So again, wash your hands and access on when you enter the unit. Staph aureus or staph infection is one example of a bacteria that is frequently present without symptoms. I mean, we got staph right here under our nostrils, right under our, wait a minute, there you go. Right under our nostrils, we got staph under the nostril flares. So that's why we have, they want you to cover your nose if you got a catheter, or if you're wearing the mask now outside. You see some people wearing the mask below. I mean, that's defeating the purpose, because the virus enters through the nasal tract into the respiratory system. And so, you know, they keep it right here instead of over your nose. Even in the unit, when you're on dialysis, make sure it's over your nose, especially if they're talking about this virus lingers in the air. So staph is one example of a bacteria that is frequently present without symptoms on a person's skin, in one's throat, or inside one's nasal passage. That's what I said. If these germs enter the body through the skin surface or pass into the bloodstream, i.e. from a needle stick, an infection can occur. That's what I'm saying. Look, let me show you something right quick. With these needles, right? With some practitioners, say they get ready to put the needle in, right? And they may say, you know, they may be right here, get ready to go in, right? And they may have forgot something, or they need to get a tourniquet, or say they have an issue and they take the needle and walk around the unit with it. Have anybody experienced this? Any warriors out here experience a technician or a nurse about to stick you? They take the cap off, and they just, oh, wait a minute, I forgot something. And they got to go to the drawer, and they carrying this needle around, or they ask you to hold it, or they may lay it down on the chucks or the blue pad. I mean, please give me a thumbs up if you experienced that, or say something, because I've seen it in my career. I've seen a technician do that, a nurse walk around holding a needle. They couldn't get it. They take it out. They walk around and they go back and use the same needle, right? The same needle that they just took out that they didn't get, and reinsert it. Are you kidding me? Don't let that happen to you. That's not supposed to happen, right? But the point is, in a dialysis unit, in a hospital, there's germs floating in the air that you cannot see. Even on the table, the arm of the chair, the chucks pad, that blue pad that they have you put your arm, they put under your arm. So if they stick the needle and blood spill down, it won't get on the pillow or your clothes. I've seen that. So let me tell you something. Make sure when they get ready to stick you that they got all the supplies and everything gathered right there. All right. Everything gathered so they don't have to leave. Right. And make sure when they take this cap off this needle that they're ready to stick you. And then after they stick you, make sure they put a 2x2, not just tape, but a 2x2, because then you're going to have an opening. You got the needle, right? You got the needle in the arm. You got the needle in the arm. And if they just put a piece of tape over it, the germs that's on the tape, on the adhesive part, right, can get into your bloodstream. It can get into your bloodstream. So that's why I always tell them to put a 2x2, 4x4 over it, then put the tape over that, and then put a butterfly tape under that to anchor it down. Also, if you got one of these, you got to be careful, right, of a bloodstream infection, because this part is sticking out, which is it's not really, it's only anchored in by sutures on the side. Right here, this is an IJ catheter, and it goes in the side, and it's anchored there. And again, this goes into a major in your jugular vein. So you just got to be careful. And this is put in for temporary dialysis. So what can you do to help? If you dialyze with a AV fistula or AV graft, always wash your access arm with soap and water when you enter the dialysis unit. And now is more important now than ever, right? To wash your hands, wash your access, because what if the virus get on your arm and somebody sneezes, right? Say they take the mask off for a moment and sneeze or whatever, and the particles drop on your arm, you got a short sleeve shirt on or whatever the case may be. Wash your arm, your access arm, with soap and water, warm water, when you enter that unit and when you leave. This will help remove the bacteria. Or if you use a CVC catheter, like I showed you, or this type, I showed you. So this is a CVC, and this is the IJ. This is for the jugular, temporary one. When one needs to start emergent dialysis, they put this in, right, temporarily, and then we start the dialysis, get the fluid off, and then they make an appointment to put this in, a permanent access. Well, it's not permanent, but it's a hemodialysis catheter until the decision is made for you to get a AV graft or AV fistula. But this catheter goes, the tip of this right here goes into the heart, right? It goes into the heart. It goes under and it sticks out like that. You got the cuff, and the warriors know who has this, how they clean it and they moving it and it's sutured down and it's pinching the skin and all that. But these are very uncomfortable. I never had one, but a lot of warriors told me that are very, very uncomfortable having this. Now, if you use a CVC catheter, right, wear a mask when the catheter is being attached to the bloodlines or its exit site is being cleaned. This helps prevent the staph aureus that may be in your nose or mouth from being breathed onto the open site. Now, let me repeat this. Share this broadcast, guys. Please share what you can. We need 50 people. Where I'm getting ready to shut it down in about 10 minutes, but we could use 50 people. Let's get this information out there. But look, let me read this again. If you use a CVC catheter, which is this, wear a mask when the catheter is being attached to the bloodline, meaning here go the bloodline, right? This is the bloodline. And this was what they mean. They want to have the mask on when you're attaching the bloodline to the catheter. When they hooking you up, you want to have that mask on. and tell them to make sure that you tug on that a little bit to make sure that's tight so it doesn't come loose during treatment. We seen that happen. This came loose and someone bled out. So make sure when they connect this, you tell the technician to tug on it a little bit to see if it's, it's not going to come apart so you don't lose your blood volume. So again, if you use this, make sure they have that mask on when they're attaching it to the bloodlines or your exit site when they cleaning this, wherever this is coming out, exiting it out from, that they have that mask on. This helps prevent the staph aureus that may be in your nose or mouth being breathed into the open site. Please note, for a mask to be beneficial, both the nose and mouth must be covered. Again, it says, please note, for a mask to be beneficial, both the nose and mouth must be covered. I'm sure you've seen people had the mask down under the chin, under the nose. That's not how you wear it. And I don't have it with me, but I have a mask in the back, but it should be covering over the nose and the mouth. All right, about to take it home. 3, wear a glove when holding your access site post-treatment. If you got an access, right, like an AV fistula or AV graft, when you holding the needles, it's definitely good to wear a glove while you holding the site, because it's easy to get a drop or two of blood on your hands when holding your site. It's also easy then to touch the scales and maybe the door handle on the way out the room with those contaminated hands. Some people I've seen held their site and they bled so much and that they finished bleed, we tape them up and they didn't wash their hands. We had to remind this person to wash your hands. All right, because some people just get up, they'd be so mad, right? Because they may have bled or whatever the case, they just want to get it taped up and get out of there and don't even think about washing their hands, and they got blood all over it. So again, and then we talked about this in one of our shows. When you go into a dialysis unit, you may want to have on gloves anyway, because you're touching the door going into the facility. A lot of people touch the door, right? 6 days a week. You got people opening the door, coming in, leaving out. The bathroom door, right, in the unit. If you got to use the bathroom, how many people use the bathroom? How many, going in and coming out? Then the door going into the unit. How many people touch the door going inside the unit? Are they wiping that down with bleach wipes each day or after each shift? These are things you got to think about if the unit is implementing. Also, you got to think about yourself as well. So again, it's easy to get a drop or two of blood on your hands when holding your site. It's also easy to then touch the scales and maybe the door handle on the way out of the room with those contaminated hands. How many people y'all know may be in that situation? You may see people touch the floor or touch something else, or dig in their pants or in their nose. Who knows? But now is the time to really be mindful of this and to look out for yourself when it comes to infection control and protecting yourself. So how can you help? Considering the number of patients who also may come in contact with these areas, as I was saying, your preventive actions are important. Because look, if you go to a dialysis unit, right? Check this out. If you go to a dialysis unit that say is 50 chairs, let's say it's 50 chairs, 25 chairs. So if you got 25 chairs, right? And you got 3 shifts. So let's just say 2 shifts are filled up. That's 50 people, right? Coming in and out. You got the staff. And then you got the people on the 3rd shift. Maybe it might be 12 or 20 patients. And you got them coming in and out. Who's wiping down the door? Who's wiping the door to the bathroom, to inside the unit? I mean, who's wiping the counter off? I mean, this is something to think about, guys. It's really something to think about. How can you help? Again, considering the number of patients who also may come in contact with these areas, and we don't know who got coronavirus, your preventive actions are important by 1, wearing a glove while holding your site. 2, taking that glove off before getting out of the chair. And 3, immediately washing your hands after getting up. This possibility of spreading germs can be stopped. It can. So again, Urban Kidney Alliance, Urban Health Outreach Media recommends that all kidney warriors, regardless of their type of access, wash their hands in the treatment area both before and after their dialysis treatment, right? So with that being said, I want to thank you guys for tuning in. As I said, you could always be watching something else, but we just want to thank you for tuning in and watching our program. Let me address these 3 comments I have here. From Angela. Hey, what's going on, Angie? Hope all is well where you're at. I think you're up in New York. You know, stay blessed and encouraged. Angie says you got people using the scale, even your treatment chair you may need to wipe down. Absolutely. Then Angie says, before you begin put on, they should be giving you face masks too. Absolutely. Then Angie says, even if it's a little bit of blood leaking, when they stick you, they are to change those gloves, both of them gloves, also when they have to restick you. Don't let, yep, you're right. You are absolutely right, Angela. Thanks for chiming in, because a lot of people don't know that, and they may see the person using the same gloves and think that it's the norm. No. Angie also says if the unit keeps doing the wrong thing, she calls iPro right away. Angie, if you're still on, can you tell us what iPro stand for? Then Angie also says, yes, I tell the tech right away, you have to change your glove. And Angie is watching from my YouTube channel. And I thank you so much, Angela, for chiming in from my YouTube channel, Urban Health Outreach Media. Okay. So guys, again, please share this broadcast. We're going to be coming with different broadcasts. I believe this Sunday at 12 noon, we're going to do a pilot show, spiritual broadcast with Lamonte Reed of Peak Performance, Minister Lamonte Reed. So please be on the lookout for advertisement for that for this Sunday morning to give warriors and anybody who wants to watch the broadcast hope and encouragement through these uncertain times. So again, guys, thank you for watching. Thank you, Ms. Mayweather, for watching. I appreciate you. I really do. Please, if you can, share the broadcast. I always ask. Thank you for watching, Leslie. God bless you. Hope you and your mom are staying safe. Hope your mom is well and is recovering well from her accident. And what else? Oh, absolutely. Absolutely. So, all right, guys, definitely be on tomorrow with a different topic. I got tons of information. That's the only thing that's going to keep me from worrying. You too, Leslie. You have a great night. I'm going here and probably watch some Netflix documentary and dream of the past. But no, guys, take care. God bless you. Thanks for watching. And I'll see y'all tomorrow. Peace. Have a great night. Stay blessed and encouraged.
Yo, it's about to go down. I said, yo, it's about to go down.